I'm Chris Stout. I'm an endovascular and vascular surgeon with Ozark Regional Vein and Artery Center. Today, we're going to talk about pelvic pain and pelvic congestion syndrome. Pelvic congestion syndrome, or PCS, is a very misunderstood diagnosis, and it's something that really affects young ladies and women in general. It is something that is treatable if it can be diagnosed, and the diagnosis is very elusive. Generally, if you're a young female and you have this, pain in your lower abdomen or back that nobody can figure out, if it's a achiness or pain that can be worsened with standing or gets worse near your menstrual period starting, that's something that can kind of point us in this direction. And there's multiple other aspects that can kind of lead us toward this diagnosis. But again, it's a very difficult subject to even bring up, let alone diagnose. What ends up happening is kind of like in the legs where you get varicose veins or swelling or pain. This happens in the pelvis, and the veins have these valves. So blood is supposed to go back to the heart through the vein. Well, what happens in the PCS patient is that the blood begins to pool in the pelvis, or it starts to go backwards in reverse flow and drains through different areas. And this can lead to compression of different pushing on different other structures that can lead to crampy pain, or pain around the period, or pain with sex. And it can really be something that affects relationships between a woman and her partner or husband. We can treat it with different medicines at first and see if those medicines don't help. I'm always a proponent of non-invasive therapy if possible. But if that fails, then there's a 90% success rate for fixing these with different types of endovascular treatments. These treatments, again, they involve kind of like the diagnosis. You put a catheter in there and see which way the blood's flowing. Well, we get in there and make sure that it's not compression of a vein that drains the kidney, which is nutcracker syndrome. We make sure that it's not some type of ovarian vein syndrome that's pushing on the ureter or causing some type of process like that. And once we can rule all those out, then we can shut down or take the blood and direct it in the correct direction by shutting down large veins that are causing compression and pain, and then blood starts to flow the way it's supposed to. So if you have any type of symptoms of pelvic congestion syndrome, it is something that we can easily fix here in the office at Ozark Regional Vein and Artery Center. Give us a call and we'll be more than happy to evaluate you.